told you, the public health emergency for COVID-19 expires at the end of the day Thursday. Here to explain what that means is Dr. Helen Boucher, the Dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. Dr. Boucher, thanks for being here as always.
Good to see you, Erica.
All right, Dr. Boucher, let's start with testing. So the ending of the public health emergency will reduce options for folks to get free COVID tests. But I guess the real question is, do most healthy, vaccinated people really need to be swabbing themselves? The guidance still says multiple times every time we get sick at this point anyway.
Well, Ben, it's true that the incidence of COVID is down, but it's not gone. We still have it in our community. And I think that it is prudent to test when you have symptoms, especially if you're going to be around vulnerable people like older people or people who have compromised immune systems.
Okay, so today, state officials said they hope we've learned that sick people should stay home. If you're not feeling well, stay home. But the end of the emergency might lead some companies to cut back on those extra COVID sick days that they've given workers to isolate, quarantine. What would you tell employers about the need to maintain that 5-day COVID isolation period?
Well, we know that staying home when you're sick is a good idea for yourself and for all the people around you at work, school, and other places. So we are encouraging employers and others to really try to find ways to allow people who are sick to stay home. I think if you have to go back to work or you have to go out, it's really important to mask. Remember, we have tools, right? We have more tools than we had 3 years ago, and masks work. So if you have to do something before those 5 days are up, if you mask, you're going to reduce the risk to others significantly.
All right, so the state is dropping its mask mandate in healthcare settings with the end of the emergency. We're the last state in the nation to do this. But the state said each facility, like yours, should have a plan on when they might need to re-implement masking. So what kind of factors will you be looking for at Tufts?
Well, Ben, it's like even before COVID, right? We're going to be looking at what's going on with respiratory viruses in general and what's going on with COVID, and making decisions about things like masks and other measures to mitigate transmission of viruses. And we're going to ask our staff to use the common sense that they have. And that means to wear a mask when there's any question in your mind, especially if you're going to be around those vulnerable patients.
All right, Dr. Helen Boucher, the Dean of Tufts Medical School, thanks so much for your time.
Thank you.